Hello and welcome to Anticlock Academy. I am Dr. Krishan Mohan Kapoor and today we will be exploring the deep fat compartments of the face and how understanding their anatomy can significantly improve the application of facial injectables. We'll cover the essential deep fat pads, their boundaries, and how this knowledge aids in targeted and effective facial rejuvenation treatments. Let's dive into the fascinating world of deep fat compartments of the face. The face is divided into superficial and deep fat compartments, and these compartments are separated into multiple subcompartments. In the midface, the superficial fat compartments are located between skin and plane of superficial musculoaponeurotic system or the SMAS. On the other hand, the deep fat compartments they lie between SMAS and periosteum. Deep fat compartments they contribute significantly to the volume and contour of the face, which is why volume restoration in specific fat pads is so essential for facial rejuvenation. Let's talk about individual deep fat compartments. Deep medial cheek fat pad is one of the most important deep fat compartments in the face. This compartment is located in the midface. This is under the SMAS plane and its superior part lies under the orbicularis oculi muscle. Its superior boundary is formed by a zygomatic cutaneous ligament that divides it from medial sooph, and its lateral border is formed by the angular vein. This fat compartment lies on the periosteum of the maxilla. Between the periosteum and the fat compartment is a potential space which is defined as Ristow space. As we age, this compartment tends to lose volume, contributing to the flattening of the midface and formation of nasolabial folds. So, restoring volume to the deep medial cheek fat compartment can help lift the midface and smooth these folds, creating a more youthful and rounded appearance. Injecting into this compartment, especially in the medial cheek, helps restore anterior projection of the face and it improves the contours of nasolabial folds and the tear trough area. Then just lateral to deep medial cheek fat pad is deep lateral cheek fat pad. This compartment is triangular shape and is located in the lateral part of the midface. This is bordered medially by the facial vein, whereas laterally we have zygomaticus major muscle in forming the boundary, and the superior boundary is formed by zygomatic cutaneous ligament. This compartment plays an essential role in defining the contour of the cheek. With aging, the volume loss in the deep lateral cheek fat pad, it leads to hollowing in the cheek area, resulting in loss of cheek projection. By restoring volume to this compartment, we can help rejuvenate the midface, improve the appearance of the cheeks, and help reduce sagging in the lower face also. Injectables placed in this compartment can lift the cheek and jawline, contributing to a more defined and youthful appearance by filling out the lateral face and helping to improve overall symmetry. Next, we have buccal fat pad. It's a fat pad in the cheek that helps shape the face in this area and also aids in facial muscle movements. It is also known as Bichet's fat pad. It is majorly present in the buccal space. The boundaries of this structure include the buccinator muscle, which is present medially, and the deep cervical fascia and muscles of facial expression. They are present anterolaterally, and the masticator space and parotid gland, they are lying posteriorly. Another important fat compartment is sooph, which is located beneath the orbicularis oculi muscle around the eye area. It has two parts, medial and lateral. The medial sooph, it lies caudal to orbicularis retaining ligament and under the orbicularis oculi muscle. It extends from medial limbus to the outer canthus. The zygomatic cutaneous ligament, it separates the medial sooph from the deep medial cheek fat pad. The lateral sooph, it is located at the lateral orbital rim area above the prominence of zygoma, but it does not reach above the superior margin of the zygomatic arch and it does not extend above the lateral canthus. So it's lying somewhere here. And It represents the upper limit of lateral SOOP. This fat pad is integral to youthful contour between the lower eyelid and the upper cheek area. As the SOOP descends with age, it leads to the deepening of the tear trough region, and it contributes to development of under eye hollows or dark circles. By restoring volume in the SOOP, we can smoothen the transition between cheek and the lower eyelid area, significantly reducing the appearance of under eye hollows and improving the under eye contour. Targeting this fat pad provides structural support, and it helps rejuvenate the lower eyelid region. There's another fat pad which is called retroorbicularis fat pad or roof. In the superior orbital region, this roof is located lateral to orbit and is bounded medially by the neurovascular bundle which is emerging from supraorbital foramen. Roof is a superior extension of the subbrow fat pad, and it's a layer of fibroadipose tissue that is situated deep to orbicularis oculi muscle, and it lies superficial to periosteum of the supraorbital bone. Medially, it extends beyond the mid-supraorbital rim and laterally beyond the lateral orbital rim. A detailed understanding of the deep fat compartments and their role in facial aging is crucial for facial injectables. This knowledge allows us to target specific compartments that have lost volume and restore them with precision. By addressing volume loss in these compartments, we can enhance facial contours, improve symmetry, and achieve a natural youthful appearance. Facial rejuvenation is not just about filling areas, but about understanding the anatomical relationships between the fat compartments, muscles, and the skin. With the right approach, injectables can provide a harmonious balance to the face, addressing the deflation and contouring in a way that complements patients' natural features. Thank you for watching today's video. I hope this deep dive into anatomy of deep fat pads of face has been insightful. Stay tuned for more videos focusing on the application of injectables in these compartments, and don't forget to like, comment, and subscribe for more detailed insights on facial anatomy and rejuvenation techniques.